difficulties, which is ironic because I was grateful that I had Wi-Fi at my vacation spot where I am right now. And 3 of my friends that are here are all like IT geniuses. So if like we were struggling, I was going to ask them, but we figured it out.
We got it.
Yay! And 808, we'll remember that. Maybe that's our lucky number now. 808 Pacific, obviously, not Eastern.
Right.
But I'm excited to talk about this because I know that for me, just the word anxiety looked like, people that were having panic attacks, crippling anxiety, not able to do the things that they wanted to do. I didn't think of it as just mild things like being sensitive and taking things the wrong way, or, being easily embarrassed for things that, you're the one that's experiencing that reaction when other people don't even think that it's embarrassing.
Right.
And related to a lot of those symptoms after seeing my SPECT and seeing this giant white spots, which meant that I had really high activity, which just that whole process was really interesting. And I've gone through that with hundreds of my patients that went through that exact feeling like I did. So I totally get it. And the good news is there's so much that we can do to get that lowered. So that's kind of why I wanted to have the title to show that you don't have to have moderate or even major anxiety to still be able to treat it so that it doesn't morph into other things or look like other things. Because for me and a lot of our patients, it looks like ADD, just straight up ADD, which is why so many of our patients do well on GABA, taurine, theanine. And then our patients that have really high activity with really high clinical anxiety, they do well on gabapentin. So instead of doing the stimulant route, they do gabapentin, which is common for pain and movement disorders, which I know Whitney is going to share more about that because it's like your wheelhouse. Mm-hmm. It's just kind of interesting to think of medications from a brain systems perspective instead of just a symptom perspective. And for me and a lot of our patients, I feel like that ADD that's really overactive basal and ganglia activity, which we see with anxiety, is so common. And so, your doctor's not going to really think about that unless you're having panic attacks.
Right. And with the anxiety, they will, be conflict avoidant, and they'll predict the worst, and they may have excess motivation. So I know when I was, there's a period of time when I was working that I was a workaholic because my idle was running really fast. Mm-hmm. And that's because my basal ganglia was not quite balanced out. So anxiety looks very different for a lot of people. I mean, people automatically think, well, I don't have anxiety if I'm not having panic attacks. Well, that's kind of one extreme on one end, but there's so many other pieces that belong with anxiety. Being conflict avoidant, like avoiding conflict at all costs, that means that there's some anxiety because there's such fear about what's going to happen if a person confronts somebody else. And so that keeps people in a really powerless place. And so it's really important to work with it and work with, a brain health coach, work with somebody who knows how to work with anxiety, because you want to be able to speak your truth and feel strong and powerful in your convictions, and be able to listen to somebody else. And so it's important to treat, anxiety can show up in a lot of different ways. So what I was going to, let me just share the screen here for a moment. Can you see that?
Not yet.
Not yet? Uh-oh. Let's see. Click in. Okay. Now I'm in a whole nother thing here. Okay. Well, I'm not going to be able to share that for a moment. So the basal ganglia is behind the prefrontal cortex, and it's in the center area. And so what a lot of people don't know is that the basal ganglia part of the brain shows us kind of where our level of anxiety is, and it shows us how much motivation we have. So a lot of times with ADD, you can have lack of motivation, and so that can show that the basal ganglia is off. You can have apathy, you can have movement disorders. This is where your thoughts, your emotions, and your pleasure is all processed through. So it's also where your auditory and visual processing is. So if you have a hard time in school with auditory or visual processing, you also want to take a look at what's going on with the basal ganglia, because that's all part of it. And something else that I don't know, a lot of people may not have heard of Irlen syndrome, which is, I will spell it for those who are visual. It's IRLEN syndrome. And that is when people's brains are too sensitive to light and stimulation. And it's basically, there's too much hyperactivity. Kind of, and this is not, I'm not going to describe it in a clinical way. I'm going to describe it in a way that it was described to me from an Irlen practitioner.
I have my book with my overlay in it, so I'm going to grab that.
Okay, good. So with Irlen, it's basically like if you think of your brain as an aperture, which is allowing a certain amount of light into your brain and stimulation. When you have Irlen, it's that your aperture is open all the time, and you're just taking in massive amounts of information all the time. So these are the people who have a hard time going into stores like Walmart that have a lot of fluorescent